Good morning, everyone. Thank you for joining us for our Monday Spotlight session, which we hope is going to provide you with some bite-sized inspiration to start your week. So thank you for joining us. It's great to have you here. So for the next 15 minutes, we're going to be talking to a special guest about a volunteer role that is really making a difference. Our special guest today is Anita Gillen from St Helen's and Knowsley NHS Trust. And for some time, Anita's been running a volunteer service in A&E, and they're called Emergency Department Volunteers. Now, we all know the pressures that A&E departments are under across the country, and the role that Anita's going to be talking to us about is really starting to make an impact on staff and patients in the department. So we're looking forward to hearing all about that. We can't take questions while we're online, but please do leave your comments on our LinkedIn page and we'll get back to you with any answers that you're looking for. So, morning, Anita. Thanks for joining us so early on a Monday morning. It's really great to see you. So you've got a well-established volunteer service at St Helen's and Knowsley, haven't you? So what was the starting point for the ED volunteer role?
We did have quite a robust volunteer service pre-COVID, but obviously they were all pulled out of the clinical areas. So since about October, we've been trying to re-establish this role, and we've recruited some of our old volunteers back into this role, and they're being the mentors for the new people that we're recruiting in there. So we want to be visible in this department, and to make a real difference and to relieve the pressures, some of the pressures that the staff are under, just by helping out the housekeeper, and chatting to the patients, being more visible. So we looked at the role that we had previously and we amended that slightly so that the volunteers are more patient facing, and the role that we've established now means that they go into the cubicles and are able to chat to the patients and be more visible on a day-to-day basis.
So it sounds as if the role has been evolving in response to the need of the department. What kind of support have you had from staff in A&E?
So we enlisted the help of the emergency department matron. That was where our first point of call, and we discussed the role there, and she said it would be ideal if the volunteers could maybe come from the front of the hospital where they used to be and come more to the in the background, so filling up the cupboards in A&E with all the night dresses, blankets, cups of water, sick bowls, that type of thing. So we said that's an ideal opportunity to maybe look at those cupboards, and the volunteers, that can be the first job when they go in, so they get a chance to talk to the patients in the room, to see if they want a drink, to see if their relative maybe wants to go outside and make a phone call, so they could sit with that patient and the relative, would feel comfortable that someone was with the loved one. And that's been working really well. We took pictures of the cupboards and we put that we put them inside every cupboard so we can just send any volunteers down if it's really busy. It's not the trained volunteers who can we would usually recruit into that role. If it's really busy, we can send them down and say, here's the housekeeper, she'll show you where everything is, just fill all those cupboards up and come back to your other role. So that's working really well. That it's more versatile, the role that we've created.
And how is it becoming embedded now in the department? How is that working out?
It's working out well because we've been asking our volunteers for some feedback, and originally before Christmas, when the feedback we were getting is that they did feel a bit invisible to the staff. They said they're not invisible to the patients, but they feel as though the staff are so busy, they just go in and do their role, and they do feel like they're making a difference. But I feel now that's evolving. The more volunteers we put in there, the staff are, they're getting feedback from the staff now, saying that they're making a difference. So that's sort of changed around, but we've still got some work to do. I mean, we have made an appointment with the matron again, because we want in handovers to talk about the volunteers, to just mention them, that we have got volunteers coming in today, so utilise them. Because if a patient's moved from A&E up to a ward and they've got medication there, the volunteer can take that up to the ward. There's lots of other added extras to save the staff from coming off the department. Utilise the volunteers. So we've still got a little bit of work to do there. We'd still like a lot more volunteers in A&E. We're up to about between 12 and 14 volunteers in there now, but in an ideal world, we'd like 70 volunteers in there. Maybe a coordinator that'll look after them. So we've still got a long way to go, but we can see the difference they're making now.
Mm. And what do you look for in an ED volunteer, Anita? What kind of qualities make a good ED volunteer?
I think we want somebody that's a bit more confident. They can go in there from when they're 18. So you want somebody that's can be chatty, maybe got a few life skills, but we can help them with that by buddying them up with the volunteers are established volunteers there. So I mean, over 18, a bit confident, and I suppose being able to cope in that kind of high pressured environment. But we check in with the volunteers to make sure that they're coping with that and they're happy in the role. So I think that's quite important, because volunteers don't like it. They tell you with their feet, they walk away, and you don't want that to happen. You want to support them along the way.
That's really interesting, actually. I wanted to ask you about that, Anita, because I guess volunteers must see some quite distressing things in that environment. So what kind of support do you offer them, or do they ask for?
They might come and say, if they've had sort of a traumatic incident, they might give you a call if they've seen something that's upsetting. And our health and wellbeing are really supportive. If we were to ring them up and say we've got a volunteer, that maybe wants a little bit of a break from A&E, or maybe they'll want the support of a buddy when they go back down on their next shift, just so they've got a little bit of support. But health, work and wellbeing will also not just there for our staff, they're there for our volunteers as well. So we have got backup if they feel a bit traumatized by what they've seen. Our door's always open. They can come to us and they can give us a call, and we'll sit and chat things through with them and see how best to move forward.
So it sounds as if that health and wellbeing team is really key to supporting your volunteer team, isn't it? Is that something you'd recommend that people do, is to form those links?
Definitely. We've got good links for health, work and wellbeing, and to be fair, there's not many volunteers I've had to refer over to them in the time that I've been here. I'd say maybe about 2 volunteers, but just knowing that support's there, is quite comforting, really. That there's something extra I can offer them.
Yeah, no, that's fantastic. And training wise, what kind of training would an ED volunteer need in addition to their mandatory volunteer training?
We give them wheelchair training. We do extra infection control training. So donning and doffing in case there's an area, if there's an outbreak there, that they know they can wear the visor, the mask, the aprons if they're going into the room. So we do that for them. We do autism awareness and disability training as well. That's something that we offer. And dementia tier 1, we offer that as well. And there's sometimes they are asked to sit with patients. you know, while they're waiting for the relative to arrive, if patients have dementia, for a little bit. So, you know, if they're a little bit distressed, just somebody to chat with them.
I'm really interested to hear what volunteers love about their role, and I know that you do gather feedback, don't you, from your volunteers? So what can you tell us about what they feed back to you?
Yeah,
what do they love?
I mean, the best feedback I've had is that the staff are beginning to notice them and thank them and saying, you don't know, you don't know how helpful it is to have those cupboards stocked up. So that's a big turnaround for us because the staff are noticing. But from the volunteers' point of view, they said that they feel really useful when they can help the patient by getting the attention of the staff if there's something that they need. If they're in that room and they say, you know, I'm sliding down the bed, do you think you could prop me back up again? They'll get a member of staff to come and do that. Obviously, volunteers can't. Being a companion to patients and listening to their story, they said it's so interesting, the people, the variety and the diversity of people down there. They really love that. They like using their time to make a difference. And just speaking to the patients, they said, just feels really worthwhile. And one of the volunteers said that the emergency department consultant actually, you know, seeked them out and took the time to say, thank you very much, you're really making a difference. So the feedback's amazing, you know.
And that's fantastic to hear, Anita. It's really great that you gather that feedback as well, because it helps to attract more volunteers, doesn't it? If you can tell them what they're going to gain from the role.
Yeah.
So if somebody was interested in starting up a similar service, what would be your top tips? Where would you start if you were starting again?
I think first of all is approach the staff, approach the matron, and start the conversations, saying what a difference volunteers could make in that area, and that it's been proved. You know, they can talk about just the simple things that they can do, starting off, say, you know, stocking up the cupboards in the rooms, and that would make a hell of a difference. Just the simple things and being visible to the patients, but definitely talking to the staff. I think you need to create good relationships with the staff in A&E to get this off the ground.
And where would you hope to be in, say, a year's time or 2 years' time? What's your vision for your ED team?
I mean, to have a service every day of the week, you know, 8 in the morning till 10 at night, and have a constant stream of volunteers, and maybe our buddies to be champions, you know, to be our ED champions, and to be able to welcome and talk at our recruitment events regarding the role, to encourage more people, because we do have challenges. You know, most of our applications we have come from 16 to 19-year-olds, and you need to be 18 to be in the emergency department. So we do have our challenges, but maybe if we can get the volunteers to come and talk about the role in real life terms at our recruitment events, that would encourage others to want to do that role.
Anita, it's been absolutely fantastic talking to you. Thanks for sharing your experiences and your hopes for the future and your challenges. It's always really helpful for others to hear that. Really enjoyed having this conversation, and hope to catch up with you again, maybe in a year's time, to see where you're at with your service. I know we'll be talking in the meantime. So thank you to our audience for listening in. It's really great to have you with us. If you've enjoyed this session and you'd like to have the spotlight on you on one Monday morning, please do let us know, and we'll arrange a chat. This time next week, we'll be talking to Sally Dyson from Norfolk and Norwich University Hospitals about their discharge welfare volunteer role. So hope you can join us for that. But in the meantime, Anita, thanks so much again. Really great to have you with us. Thank you.
Pleasure. Thanks.